Dear friends, myself Dr. Soumyakanti Datta, consultant interventional cardiologist. Sitting in 2023, we all know that the incidence as well as the prevalence of hypertension is increasing. In almost one-third of the urban population and one-fourth of the rural population in India are hypertensive. And the most astonishing fact is that they are not either treated properly or adequately treated. So, the diagnosis of hypertension as well as the treatment is very much essential. We call a patient hypertensive when his or her blood pressure is more than 140/90. So, only single reading at a doctor's chamber is often misleading because so many of those patients may have white coat hypertension. That means they may have a false rise of blood pressure when they are visiting a doctor's chamber or clinic. But it is always recommended and necessary that we all should measure our blood pressure at home. If we are diagnosed with hypertension or taking medicines by a doctor's advice, we must record our blood pressure by either a sphygmomanometer, whether it is digital or a manual one. So, how do we record home-based blood pressure or how do we monitor them? This is essential. By simply keeping a digital sphygmomanometer, we can record our blood pressure. Generally, it should be done twice in a day, early in the morning after breakfast or in the evening hours, at least 5 days in a week if you are taking a medicine. Believe me, home-based blood pressure monitoring is equivalent to the ambulatory blood pressure monitoring or ABPM. What is ABPM? This gives us a data of round-the-clock blood pressure. That means one single reading should not always guide us in the treatment because at a single point of time we may have a rise of blood pressure but it may fall when we are at rest. So there are several causes of hypertension apart from the essential hypertension or true hypertension. We must diagnose them and treat them accordingly so that we can prescribe proper medicines. And believe me, if you are taking proper medicines in hypertension, the control of hypertension is not at all difficult. So over and above taking the medicines, it is always recommended to take proper diet, to restrict your salt intake, to have healthy vegetables and fruits in your diet. Potassium rich diet is essential to reduce your hypertension. Having an adequate sleep of 6 to 8 hours a day is very much needed. Now, brisk walking as well as the aerobic exercise is always recommended. 30 minutes a day, at least 5 days in a week will help you in reducing hypertension. And the foremost thing is that quit smoking and alcohol, restrict your alcohol dosage definitely, avoid stress and strain at your work as well as the house, and maintain healthy diet, exercise as well as keep your brain healthy to restrict from the hypertension and to prevent the hypertension mediated organ damage. Believe me, if we do not control hypertension at an younger age, it may lead to deadly situations like brain stroke, heart attack, peripheral vascular disease, even several ophthalmological problems too. So, adequate diagnosis of hypertension and treatment of hypertension is very much essential. Never treat yourselves at home. If you are diagnosing, if you are seeing your blood pressure that is rising at home, do consult to your physician or a cardiologist and have proper medicine, and the dose adjustment is very much necessary. If you treat yourselves, you may land up in massacre because these medicines which are prescribed for hypertension may have several side effects, and it is always recommended that you please prescribe or you please take your medicines after visiting your or consulting your physicians or cardiologists. We should recommend a few tests for hypertension, that is at least do an ECG and echocardiography once a year, do your thyroid status, creatinine function or the kidney function test, and several tests are recommended. So though we are hypertensive, the increasing incidence as well as prevalence are there in India, but believe me, if we can treat ourselves properly, we can prevent these deadly outcomes. So thank you very much. Have a nice day.